Hey guys, Dr. Ray Marquez here, your local chiropractor and back pain relief center. We're here with Alex today. Alex is the lead jiu-jitsu instructor at our new Myrtle Beach BJJ and judo club over at American 24 Fitness. Just a side note, we open up Saturday 10 a.m. For open mat / class. Come in and give it a try. So I've known Alex for a while and he's all beat up. And he trains harder than anyone I know, but he's got all kind of problems. So he's got a bad shoulder, bad neck, his back gets jacked up, the knees are bad, everything hurts. But my job is to keep him on the mat. So unlike a lot of other doctors, I'll never tell you to get off the mat and don't train. I'll keep you going. So if you do judo, you do jiu-jitsu, you wrestle, MMA, any of that stuff, I'm your guy. When you come see me, I'll keep you moving, I'll keep you on the mat. So today we're going to address Alex's shoulder and his neck has been bothering a little bit. I think I threw him around a little too much this morning, or he threw me, I don't know how it went. But we're going to keep all this straight. Then we're just going to manipulate his back, and that prevents injuries and keeps them rolling. So here we go. So Alex, first I'm going to do some muscle work on your neck, and then we'll switch to both shoulders. Right. So I'm going to do some soft tissue work because a lot of stuff that we injure doing these sports is soft tissue injuries. If it was a bone problem where, like a sprain strain type of thing, we wouldn't be doing this type of work right now. We would be doing anti-inflammatory kind of stuff. So anyway, we're going to break up some scar tissue, loosen everything up. I'm going to put some pressure on his muscles. And Alex, I want you to go down. So you're going to look all the way down and then come back up. We're going to do that 5 times. So 1, 2, 3, 4, 5. What I'm doing, I'm putting pressure on the muscle knots, and as he goes through that range of motion, it breaks up those knots to increase motion, to decrease restrictions. So now you're going to turn your head and go up and down 5 times. So all the way down, big pull. 1, there you go. 2, 3, 4, 5. Good. Other side. 1, 2, 3, 4. Good. Okay, now we're going to go to this shoulder. So I'm going to put some pressure on here. You have arm out and come all the way up as best you can 5 times. Okay? 1, going to hurt a little bit. 2. What I'm doing is putting pressure on the capsule or shoulder capsule. So when he goes through these range of motions one more time, it breaks up that scar tissue that's inhibiting some of that motion. Okay, you got to touch your knee and come all the way up as best you can 5 times. See that restriction? That needs to be better. 1, just go right. I don't need to go too far through the pain. 2, 3, 4, 5. Good. And touch stomach. Take your back 5 times. 1, tender. Yeah. 2, 3, 4, 5. Good. And here. See, when a patient can't bring their arm back like that, that's a rotator cuff problem. So we're going to attempt to loosen it up. He's got a bunch of degeneration in there. We know this through MRIs, and we send him to an orthopedic. I think the orthopedic, did he suggest surgery? Yeah. So he suggests surgery, but we're going to put that off as long as we can. So this will be painful for him, and my goal is to try to push that surgery off as long as possible. So here to there, 5 times. 1, 2, 3, 4, 5. Good. Okay. I'm going to be here, down, out, back, up. 1, 2, 3, 4, 5. Good. All right. So that could be tender later on. So what we're going to do with Alex. If this is tender for him tonight, it's not that it's doing a bad thing because we're just trying to loosen the muscles up. I'm going to give him a bottle of Relief Assist, which you've seen in some of our other videos, and it's a topical pain reliever. It's a roll-on. It's all natural. There's no chemicals in it or anything. And we're going to have him put that Relief Assist all over there. We're going to have him ice it because even though it hurts because it's jacked up in there. We need to get that muscle loose so it doesn't hurt as much. All right, so let's go to your stomach. We're going to move on to a spinal manipulation. The first thing I'm gonna do is use a handheld instrument. You can just relax your arms wherever you're comfortable. And I'm just gonna vibrate all the joints going up and down his back to increase mobility, to increase range of motion. This way we don't have problems in the future. The next thing I'm going to use a massager, and I get a lot of slack on this because it's kind of just like something you'd buff your car with, but you know, whatever, it does a good job in loosening the muscles up. Next, we're going to do an upper thoracic manipulation. And this will help with his neck pain because the upper thoracics and lower cervicals, or upper back and lower neck, tie in quite a bit. So drop your hands to the floor for me. Take a deep breath. Let it all out. Just a light manipulation. Good. Just a little pop. Good. Alex, did we adjust your neck, or does it bother you when you adjust your neck? Have I adjusted your neck?
Yeah, you adjusted.
Does it bother it?
No.
So I ask my patients that because half my patients get a lot of relief and they want a cervical or neck adjustment. Other people, the noise or whatever it is just freaks them out. They don't want it done. So I always ask. So next we're going to adjust his neck. And again, it's just to increase some range of motion. Just going to move you this side. Good. Hey, just nice and light. Good. That's all it was. Just lay on your side face me. Next we're going to move on to a lumbar manipulation. And we'll keep your bum leg straight. Already popping a little bit there. Good. I think we got it coming around the side. It's like a, what's that called? Twist the body? In jiu-jitsu?
Twister.
It's almost like a twister for you jiu-jitsu guys out there. That's all it was. Okay? Come on up, sit on the edge here. Next, we're going to do a mid-thoracic manipulation. This is great for all you guys out there that train because everything moves forward and we're tight. We're going to loosen this whole area up. So one there, bring your legs closer together, chin down to your chest. I'm going to lay it back. That's all it was. Good. Nice. All right, you come around this way. So there it is, that's a general manipulation. Well, what we would do after this, if we need it, we would do some electric stim, some ice, give some stretches to do at home. Definitely going to ice his shoulder and use some relief assist. And we're going to have him up on his feet and ready to go for Saturday, October 1st at 10 a.m. Myrtle Beach BJJ and Judo. We're inside American Fitness, or American 24 Fitness in Murrells Inlet. Come on over and see us. Thanks for watching. Thanks.